Hey everyone, thank you for joining us for this webinar on practical tips to help your practice. I want to thank Dr. Samadrala, Keith Mounty, and Mickey Hannon for joining us and sharing from their experience. Hopefully you'll get some value out of some tips, some ideas that they share with you to help you, especially during the COVID pandemic. I know things are a lot different right now than just running usual times. And I'll give some quick introductions. So and you guys might know some of these people already. It's the community in Nashville seems like some people reach out to me and said, "Oh yeah, I know Dr. Sam," or "I know Mickey." It's funny how small the community is. But just real quick, just to introduce some people, Dr. Samadrala specializes in keeping patients healthy from birth onwards, and his practice is America Family Doctors. Keith has been in technology for over 20 years, and he helps many of our clients, and we have quite a few physician clients who we work with. So I'm going to hear from his technology expertise. And Mickey is director of healthcare at Horn, and he specializes in business accounting consultancy for healthcare clients. And so they're all going to share, Dr. Samadrala can share from his experiences in technology, his EMR, and kind of things he's done. I feel like he's been ahead of the curve. We met with him about more than a year ago, and I just remember seeing the stuff he had going on in his practice. He seemed a little more ahead than what I saw at some other practices. So I thought he'd be great. I feel like he might have been even more prepared for this pandemic than your typical physician practice. So it was pretty neat. And then Mickey, he works with a lot of they work with obviously a lot of physician practices, helping them on the accounting side, helping them with cash flow, and he's going to share some ideas on cash flow. And Keith, he's going to talk about, just being efficient, being secure. Sometimes in a haste to go remote or do things a little bit differently, we might forget some things, and especially as it relates to security, and just make sure we keep some of that front of mind and keep the important things front of mind, because you read a lot of news about all these vulnerabilities out there. And there are a lot, but sometimes it's the easy things you need to be looking at, not so much these ones that are rare and very randomly happen. So I'd like to kick it off with Dr. Samadrala and just talk about, your move to telemedicine and kind of what you've done and what you're doing to keep your practice going really well and smoothly, seeing your patients and how you're taking care of your people working remotely, if they are working remotely. So I'd like to hand it off to you, if you don't mind, kind of just share a little bit of your experience and maybe share what you've done ahead of time that you might have. Maybe you did it in the past and you didn't realize it was going to help you, but it ended up helping you during this time, if anything like that happened. So, yeah.
Sure, definitely. Well, thank you, Sonny, for the introduction. And I'm Dr. Steve Samadrala, medical director and founder of America's Family Doctors. We opened our practice in 2002. And actually, one of the main reasons we opened our practice was when we're looking, I went right from my residency to starting my own practice. In 2001, pretty much all the practices out there were paper. So I wanted to start off computerized, paperless EMR to begin with. And that's, of course, the first thing we did. And the second is we use eClinicalWorks, and we have eClinicalWorks 11e as well, which is web-based. And we also use Citrix as well. So Citrix is nice because the same desktop that we have at work is the exact same one we have at home. So there's absolutely no difference between being at home and at work. And the only difference is at home I have two nice big 27-inch touchscreen Chrome computer with dual screen, so I just have more space, a little bit nicer office. but outside of that, yeah, and so really, I think the big thing probably that Sonny was alluding to is that we went to Chrome's long time ago, just because, say in our experience, we've bought over 100, Chromebooks or Chrome bases. What I'm using right now is a Chrome base, a 27-inch Chrome base touchscreen. If we bought over 100 of them, none of them have ever had an issue. And there is no antivirus or spyware or anything like that. MacBooks, and they're just ridiculous. They're crazy expensive. And on top of that, even those have issues. But regular Windows PCs, if we bought 100 of them within a year or two, 100 of them would have had issues. So.
And I think you mentioned at the time the cost of replacing one, the Chromebook was so much less. It wasn't just the Chromebook was less expensive. Like, wasn't the maintenance of replacing one even better than?
If anything, we were paying, like the 27-inch touchscreen one I bought right now that I'm using right now is, The biggest problem, I mean, I may have paid like $220. I mean, it was crazy how affordable they are because so many people. I mean, we were buying them used because people weren't even buying Chrome bases. I mean, we have Chrome bases everywhere, and so they stopped making them. This was
Wow.
before the pandemic, and so
Right.
we were buying them for $90, $100, $150 at the point where we just right now we have like a whole closet full of Chromes
Wow.
just in case Chromebooks and Chrome bases, just because we were nervous that, people weren't using them. But now the pandemic has kind of changed everything. And really with the Chromes, I mean, it's wonderful, heaven on earth with using these computers. I mean, they're fast. They don't have fans, there's no updates. There's no going to the Apple bar or anything like that.
So you mentioned Citrix though. So you use a Chromebook, but does like eClinical works? Does all these everybody has these different EMR packages, whether it's, Allscripts or Athena. I mean, does eClinical works work by default on a Chromebook, or is that what you're using Citrix for? Just
no. I mean, we can do both. We use eClinical Works 11e, and we use Citrix. I mean, I mean, 11e is probably the better one. It's GUI Windows, but and you could use it on any computer. But the Citrix is just you get so comfortable with your desktop and all that. It's kind of like going from Microsoft Office on your desktop versus Microsoft Office and Outlook on the web-based one
in the cloud.
In the cloud, yeah. So,
and did any of that help you when you went with the pandemic hit? Were you able to utilize? I mean, did you send Chromebooks home with people, or do your people even work remotely, or does any of that play in telemedicine at all?
Yeah, I mean, for the most part, everyone who is working remotely already had their Chromes at home. We've pretty much set everyone with. We bought Chrome boxes for homes for the most part, where Chrome boxes it's a little device where you can plug in two screens. But I mean, this one, the Chrome base I'm using right now has an HDMI out as well, so I can use that for the second one. But I mean, as far as I'm concerned, I mean, the price of these things, I mean, right now, I guess we haven't bought anything since the pandemic. I mean, I imagine everything got more expensive or harder to find. But beforehand, when nobody wanted it, I was like, well, anyone who wants anything, we'll give it to you. It just makes sense because the price is good. And for the most part, I'd say, we're doing telemedicine. Like there's days off that today I took a day off, but other days off, if somebody wants to do a televisit, I mean, I definitely have done them from home. I mean, why not? I mean, I could do them all the time. The only thing I don't want to do personally is collect the copay, right? So as long as somebody collects the copay, I could take it from there. And it's just good continuity of care. Now we're going with Helo. We have Helo kiosk and Helo check-in, which we're in the process of implementing, where the patient from their own home or so on can pay their copay as well and verify their insurance. So that's one less worry for our staff. But the biggest thing is that's worked for us is we try to schedule our televisits in the noon onwards, and we'll put a note on there. A lot of times we try to collect their copay and verify their insurance when we schedule it. But say if we have somebody at 3:00, but then we'll have a note on there saying that they're available from, noon onwards. And it's been a major blessing because anytime there's like a no-show or somebody cancels, then we can just go on and do the televisit too. And then we can still see the same number of patients and actually be done earlier because most of our afternoon slots are televisits. But then if we're already done with our televisits, then we're done.
So I got two questions on my Helo for check-in. I know I go to the doctor. I just went to orthopedic just last week, and they sent me an email ahead of time, and it let me do all the form they normally give you when you get there, and you fill everything out. I was able to do that on my computer or my phone ahead of time, so I didn't have to touch a kiosk. Does this Helo app allow you to do that as well? Like if a patient gets there, can they do it on their phone, or do they have to use a kiosk?
Yeah, I mean, I think It does, but it's probably not the easiest to use. So,
Oh,
so
okay.
that's where the Helo check-in comes into play, where they automatically get a link and do that. Do you know what EMR that was that you were using?
It was the EMR was Greenway, but I'm not sure if that app was a third party app or if it was part of a Greenway app. I'm not
Yeah, I
sure.
think it's Frisia.
Was it Frisia?
Yeah, they've got the whole solution with the tablets and online and all that
Yeah.
for check-in.
Right. They had, I'd use the big orange tablet, and I like the idea of doing it without, especially right now, where I'm trying to touch as little as possible and just, do everything remote.
Oh, so Frisia was able to send you a link to your phone then?
They were, yes. Yeah.
Okay,
well,
yeah.
It was an email, and I clicked it, and I was able to do it from my phone, and it had a good, some websites have great interfaces for the computer, but not for the phone. This one actually had a good interface for both. Like the phone interview went fine on the mobile version, which was nice. It's because you hate to open up a mobile website and it does not look as clean as the real website.
Yeah.
The other question is, because we're at, Acumen Technology, we're all remote now. And I think we have to work hard on just the authenticity that comes through when you're having a meeting with someone. It's easier in person, and you're really easy to communicate with. And I've had meetings with you. Are you able to keep that up with your employees, or not with your employee, with the telemedicine visit? If I come to see you as a patient, you get that that vibe and that feel from just talking to Dr. Sam, right? Do you feel like the patients still get that personalized feel when it's remote?
Actually, a lot of ways it's better, just because, in the doctor's office, you hear the intercom going on, they're nervous. They need to get out of there. We need to get out of there, go to another room. But
Right.
when we got these headphones on, and it just feels like it's just you and I, and
Right.
and then if I see something like a check mark, behind our patient's head or my friend's head, then I'm like, what's that check mark? Getting it done? What's that book? What's that book behind you? I'm actually kind of curious.
It's Checklist Manifesto.
Oh, there you go. I love that. Yeah,
Checklist
Checklist Manifesto. Yeah, that's a healthcare.
Great book.
Yeah.
I mean, obviously, it's from healthcare, but I think that book applies to so many things everybody does, right? It just, I feel like everybody can benefit from that book.
Yeah, so we always find something like that, and then we can
Right.
relate. And I talk about that book all the time, or that concept all the time.
Great.
And then the other thing is, and now for the most part we're wearing masks too. So I mean, what I try to do is I try to smile, as long as I'm more than the 6 feet apart, show my face, and then I put the mask on,
Right.
and then and the big issue we're having now, when people are taking their pictures on the kiosks, they're taking pictures with their mask on. So it's
Not very
funny.
helpful.
Yeah. So the telemedicine is kind of a relief. No masks. So
Yeah, that is nice. A good point. Yeah, everybody has a mask on. It does feel a little bit. Hey, Keith, just on that, him having Chromebooks and everything, or Mickey, either one of you guys. What do you, any input? I mean, it seems like great solution, and I guess from a security standpoint, less updates probably. I don't know, Keith, in your experience, is there less updates, more? Because I know with Windows, it feels like there's always.
Oh
updates.
yeah. As I'm hearing you talk about all that, Dr. Sam, yeah, absolutely. I mean, that's a great approach. The Chromebooks are definitely going to be a lot less maintenance, fewer updates, less of an attack surface, so to speak. There's just not as many vulnerabilities on them. I think, you are just so technically proficient and comfortable with all these things. I'm sitting here thinking to myself, in most cases, when we're engaging a physician practice, they have made their selections of technology based upon their provider's needs, and then we're kind of told, set this up. And I'm wondering how to, if you would have any tips for the providers that are a little less technically proficient. You were able to balance the the accessibility. You knew about picking a web-based platform, or using Citrix to enable you to get in. How do other providers need to balance, picking on the needs of the practice versus the technology side of things?
Well, that's a good question. I would say most EMRs now are essentially web-based. And if they're web-based, then, I mean, it's just kind of a no-brainer. The only issue we have with the Chromes is, I'm with your print, no problem, but scanning. So, I mean, ECW did recommend some scanners, and we bought them, but our goal, of course, is to do as much P2P as possible, so that way we don't have to scan and fax as much. But really, we will have, just the front desk computers that have a scanner. has that. But I'd say, I mean, the good news about the Windows computers is they all break and die anyway. So when they do, just replace them with the Chromes. And now people will probably want them more because you can't get them. There's such a shortage of it. So I mean, all the schools are going. I mean, they're literally selling billions of these worldwide now, a billion more than they have been. Yeah.
I think, Sonny, are you muted?
I'm sorry, Keith. I don't know if you answer this, Keith, but do you know will Office run natively on a Chromebook now?
Yeah, the web version will, but to Dr. Sam's point, not the same experience. So layering the Citrix on top of it. You know, as I'm hearing you talk about all this, I think the key to remember is, I guess, for other practices that aren't as technically proficient, maybe with the decision makers, it is engaging a technology provider, if you're not comfortable, to help on the technology side of things, because you really were intentional at the technology choices to allow you to do all these Chromebooks and to realize all those savings. And I know I'm thinking, you know, if the average client of ours said, if we want to go to all Chromebooks, would have a lot of challenges to be able to get to that point because they don't have the technology infrastructure with the Citrix and the web-based apps, you know, where they can do that. So it really is, you have to be intentional about picking the right technologies to set yourself up for that solution.
Yeah, that's awesome.
Well, I mean, the thing about it is that, like, in the past, whenever, you know, we had to buy it this long time ago, you know, ECW would say, buy this souped up Dell laptop with all these, you know, RAM and CPU and stuff like that. And then within, you know, you spend a couple $1,000 and then you have to have your tech guy set it up and all that kind of stuff. And then when a year it becomes a book, you know, trash, right? But the nice thing about the Chrome is there's absolutely nothing to set up. So when you open the mail, I mean, you just hand it to them. And I mean, I'd say for the one thing that you can do, I mean, there's like for Chrome, you could have like a network. I mean, we do it on our own, but you can create your own Chrome Enterprise. But honestly, when I looked at it, there wasn't really much advantage because we didn't really do anything with the Chrome Enterprise. So
that's why I made that first investment in Citrix. That's probably the biggest investment. Once you have that, then everything does get a lot easier. Mickey, does any of this ring a bell? Does any of this make from what you do anything more complicated? If you come into an audit or, you know, when you're doing your consulting, whether they're doing stuff with Chromebooks or they're doing stuff remotely or work from home, does that change anything?
No, in fact, what I would say is, you know, I'm really impressed with the fact that, you know, Dr. Sam has really embraced this technology, which has allowed him to continue to function during a period of time where there's a lot of social distancing occurring in the offices, which has slowed down the productivity of most medical practices. And when you slow down that productivity, you slow down the cash flow. And so I would just encourage, you know, every medical practice where it makes sense to embrace the technology and find ways to increase your throughput of, you know, patient volume. So that's my opinion.
Well, yeah, and sorry to add on to that from a, you know, from a kind of a HIPAA standpoint too. They're more dumb devices, right? So Citrix or the web-based version, nothing's being saved on the hard drive. So it's not like the VA where, you know, a couple laptops were way back when there was an issue with a couple laptops being found with millions of records. So that respect, yeah, that was another driving force for us, that we just didn't want Windows laptops, period. In fact, yeah, we have a bunch that just sit there that nobody uses.
Great.
Yeah.
Well, hey, one question just popped up, and then Keith, I'll go to you to kind of talk about, you know, working remotely and being efficient and stuff. Got a question from a local physician. What do you think about the SRA tool? It feels overwhelming with over 100 pages of questions. I guess Keith or Mickey, I know that probably involves both of you guys.
Mickey, I'll let you talk. I'll kind of dovetail that into what I was going to talk about anyway here next.
Sorry. Yeah, I don't know that I have a comment on that.
Okay.
I'll bounce you. Yeah, I don't know that I can provide input on that.
That's fine.
Well, then I'll say I was going to talk about some security tips.
Oh, okay, good. Well, you just take that. So someone just threw that in there. So yeah, go ahead, Keith.
Well,
talk
Yeah,
about
so
that
to
one.
address the security risk assessment tool, I agree. It is overwhelming. I feel like we're in this age of security risk kind of inflation, kind of people talk about grade inflation in schools and stuff. It's a security risk inflation. Everything is a critical threat, and it's really difficult to filter through it. So I was going to talk about a couple key things because we would leave all of that paperwork to an accounting company like Horn Cyber or someone to go through all of that and do kind of the paperwork side of things, do the formal risk assessment, especially because that covers things beyond just technical controls. There's physical safeguards, other things like that go beyond technology. On the technology side of things, what we really try to focus on is the realistic threats. And there are certain things that we've seen real world, the real things that are happening to people. And I know that you're all probably just feel beaten over the head with all these security tips for working remotely, security tips for your practice, all these security things, 100 pages of SRA stuff. So it's a lot. So I just want to touch on just a couple key things that are the realistic threats, in my opinion. So everyone is worried about being able to access things remotely, working from home, work from anywhere. Very handy thing to be able to get to your stuff from everywhere. Back in the old days, stuff was kind of confined to people's networks, and they had a firewall in between them and the rest of the world, and you couldn't get to things remotely. You had to be at the office to be able to log on to systems. So you had that protection. Nowadays, with it being accessible from anywhere, it's just your username and password between you and all of your data. So the first thing I wanted to underscore was use good passwords. Don't reuse the same passwords across multiple systems. A lot of people, when you're forced into making a complicated password. So how many complicated passwords can we remember for 100 different sites, right? So we use the same password, but guess what? Out of those 100 different sites, one of them's gotten hacked, and all of those passwords are out there. And these password lists get circulated around the dark web among these hackers, and they have these lists of known passwords, and then they can try it against other sites. They do these brute force attempts where they just try each of these usernames and passwords, and they eventually break in. They try it. They can hit common sites like Office 365, where they know a lot of people have accounts. Just use those known usernames and passwords, and they get lucky. Pretty often. So don't reuse those passwords. The solution there is use a password manager. There's lots of free password managers. We're encouraging our clients to provide password managers across their entire practice for their employees to use. So there's ones where you can control it as a practice, have your employees put it into the password management tool where they can have a safe place to keep it. I notice some people that feels like the wrong thing to do. You're told not to write down your passwords. But we're just saying, hey, don't write it down on a sticky note and then start that telemedicine visit with sticky notes. Don't do that. But putting it in a secure, password-protected password vault is a very good way to handle it. The other thing, yeah.
Oh, Keith, sorry. I know I do this, and what do you think about using Chrome to save your password? Is using Chrome to save personal passwords or work passwords, in your opinion, okay? Or
I think it is. Yeah, I think it is. I trust Google with the passwords. I know it seems a little bit weird because you're worried about Google getting hacked, but they're all encrypted and hashed. Google doesn't actually know your passwords, and that hasn't been the actual problem. So it goes again back to what are the real threats that we're seeing versus
Right.
what seems like it's a perceived threat, but it actually is not a problem.
Right.
So using Google's fine. I've got on that front, there was something else I was going to touch on. But let me hit one more thing related to the passwords.
Okay.
The other piece of it, use a unique password for your practice-related logons for each site, not just all your practice-related logons, but for each site. Put them all in that password manager. Let the password manager generate some crazy password that you're not even going to try to remember. You just copy and paste it in each time.
And to be clear, when you say each site, you mean your Citrix password is one thing, your ECW password's a different password.
That's right. You're trying to make them each different to minimize the chance that if one of those passwords gets stolen, that they're not in everything. I know it's Oh, and I saw a question pop up. A free password management app. I use what's it called? Bitwarden. I like that one, but there's lots of ones. LastPass is a more popular one, and there's lots of good ones. But anyway, there's also some shady ones, I suppose. So, and I guess it's what scares people about it. You
Right.
you don't want to accidentally sign up to some scam site. But LastPass is a very good one, and Bitwarden is a very good one.
Okay.
But the second part of that thought is multi-factor authentication. My rule of thumb is if you can access that site from anywhere with just a username and a password, even if it's a unique password, that's not a great situation. You want to have multi-factor authentication. You never want just a username and a password between you and your data. So if it's something that you can only log on to when you're at your office, that's kind of a second factor. You've got that protection of having to be on a trusted network. So that's okay. And we're used to that. We log onto our computers with just a username and a password. But if you can access a website from anywhere, from any computer, from that computer down at the library, from anywhere, with just username and password, that to me is a red flag. You really want multi-factor authentication. I know that gets technical with setting up, so you're probably going to be, if you're not Dr. Sam, you're probably engaging your technology provider to help you with that. But most sites should support this nowadays. It's becoming really expected. So sites that didn't in the past have really gotten pressure, and they offer that now.
Well, the nice thing about it, like ECW 11E and so on, those can be, you could just turn that on within your EMR for multi-factor authentication. So
yeah,
but
right. It's become pretty standard to offer that nowadays, but not in early releases. So a lot of people never turn that on. They never think about it. Anyway, I wanted to touch on also tips for using personal devices at home. And relating to that Chrome question you asked about letting Chrome save your passwords. If you use a personal device at home that you share with your kids especially, but even if you use it for other personal stuff, a good practice is setting up a separate user profile on that computer. You can set up different users on the computer, so you can have a work profile and you can have a separate Google Chrome logon with a separate work account. So your Google bookmarks and your Google passwords and all the stuff that's on the saved there in your browser history and what sites you're logged on to, it's all tied to that user profile. And then if you log off and your kids are on that computer, they can't just go to Office 365 and it's remembered your password, so they're straight into your practice email or something. So having a separate user profile allows you to have some segmentation on your personal computer. Of course, another good approach is making people log on to a remote desktop or Citrix session, so that's containerized as well. But even then, you don't want that browser saving that log on to the Citrix site or something like that. So having a separate profile on a home personal device is a good, pretty simple, straightforward practice. So I know we get into all these crazy technical things on the stuff like the security risk assessment, but I think those two things are pretty accessible to most people to do, and I think that helps more than anything.
And how about communicating within your team, like when you're remote? Ideas on how to communicate with. I know some people, we use Teams, Microsoft Teams, and
yeah, I really like Teams. I think that's a great tool that a lot of practices can benefit from. An IT director at a client once gave me a good analogy. He said, these security restrictions that we put in place, it's kind of like trying to keep water from flowing downhill. Whatever you do, the users are going to find a path, and they might just find a path that you didn't want them to find, by closing off, various avenues. So you got to make that channel for that water to flow downhill. And Teams is a great HIPAA compliant replacement for text messaging or email. I know a lot of doctors, they're going to resort to text messaging if they don't have another instant messaging platform. And with Teams, you can have instant messaging on your phone, on your computer. It's all contained within your practice. Microsoft will have will sign a BAA. So it's all HIPAA compliant, and it's much more secure than letting it go through your cell phone provider, going through text message or email or anything like that. So for those of you that might not know what Teams is, it does a ton of stuff. It's instant messaging, one-to-one instant messaging. You can have different groups, so you can use it for the billing department can have a channel where they have a group chat. The partners can have a channel where they can talk about cases or whatever they want to talk about. That's separate. You can share photos. You can share, whatever you want to through there. So it's a great tool that I think a lot of practices could benefit from.
Awesome. Okay, great. Mickey, why don't you, I guess, lead us off and talk about, we're talking about security and being efficient and telemedicine, but I think a real concern for a lot of physicians is keeping the doors open and it's really serious. I mean, keeping the cash flow working, especially right now when a lot of elective stuff, there was phases where we couldn't do elective procedures, and that hits a lot of people, or not a lot. It seems like it hits many people that do that. So help us out and help practices understand how to help that scenario.
Sure, Sonny, and I appreciate that. And just so you know, we've been dealing with this. Most of our clients are either physician practice that are specialists, which means that they were hit with, restrictions on elective procedures. So most of them had some level of shutdown. Some of them were shut down completely. Some of them were shut down, 50 to 60%. But at any rate, it very significantly affected cash flow. And, some of the common questions that we're getting now is, how do you manage the cash flow situation? And also, how do you deal with the sources of funds that have been made available through the CARES Act? And so one of the things that I like to kind of talk through is just keeping track of those funds. So, for example, CARES Act, as most every physician practice knows now, implemented the Paycheck Protection Program, which allowed for forgivable loans that were essentially operating capital that represented about 2.5 months worth of payroll. Also, Health and Human Services, or the Department of Health and Human Services, initiated what's known as provider relief stimulus. And then also, to the extent that a practice was either still operational or is now back up operating, you have your normal working capital, just cash flow from collections on accounts receivable and cash flow from that's being generated with patients coming in. Right. So some confusion that folks are having is, there's a lot of rules and regulations regarding the use of these funds, but really it just comes down to an accounting function. So, for example, HHS for some of our medical practices that accept Medicare, they were some of the first recipients of HHS funding back in April, and literally funds were deposited into their operating account from HHS. And one of the attestation questions was, you don't need to commingle the funds. Well, I find it interesting that the federal government commingled the funds for you automatically by putting it into your main operating account. And so there is some level of concern about how do you take care or manage and track these relative revenues and expenses. And really, we have recommended that you do set up a separate account to put those funds in, and then simply transfer them to your operating account as you incur eligible expenses. And with the Paycheck Protection Program, the rules have changed over the last several weeks, where initially you were only allowed to utilize those funds during an 8-week period or capture expenses during an 8-week period. Well, now that's been extended to 24 weeks. So the benefit of that, it allows most medical practices, most of our clients, will be able to utilize all of their PPP funds within 12, 16, 18 weeks, and not utilize those funds for any other operating expenses. And where that comes into play is it really gives you some freedom with your HHS funds. So some of the compliance related to HHS was you can't use HHS funds for the same expenses that you are using PPP funds for. So what we're recommending for our clients is, let's track our eligible payroll expenses for PPP loan forgiveness. And when we've exhausted that, then let's utilize our HHS funds. And that seems to be a much easier way to make sure you're in compliance. And those HHS funds can really be used for operations. They're not restricted to just COVID-related expenses if the medical practice incurred, a loss of revenue, if they can document that they had a loss of revenue. And at least for the clients we represent, all of them are very easy to calculate loss of revenue, because most of them were shut down for anywhere from 6 to 8 weeks before they were allowed to come back online. And so again, this really just becomes an accounting function of being able to track those expenditures, make sure that you are following the guidelines. And again, having a separate bank account does help with that process. It gives you some level of discipline as it relates to when you move those funds into your operating account. And then
now, when you mentioned the HHS funds, sorry to interrupt, because you mentioned PPP plus HHS. Are you saying those can all go into a separate account, or are you saying keep them all separate?
Yeah. So what we've done is simply had our clients establish one separate, we're going to call it a government's fund account.
Right.
And we put HHS and PPP funds into that account. And then what we're doing, and again, this is not a requirement, but it's just a way to help you kind of mentally think through incurring eligible expenses. And so for most practices, the largest expense on their books is payroll. So as you're incurring eligible payroll expenses, you simply transfer funds from this government account over into your main operating account. And once you've exhausted that PPP dollar amount, what's left over is HHS. I don't know that it's worth the effort to create, multiple accounts to keep up with HHS and PPP, as long as you can account for how you spent those funds. And again, the flexibility that was allowed through one of the latest releases as it relates to PPP, which allows us to utilize that over 24 weeks, does create the flexibility that we need as it relates to our HHS funding.
Okay, great. And is there any, and again, this is outside my area of expertise, but when it comes to coding and stuff, and Dr. Sam, you may know this as well, but are things being coded differently when it's telemedicine visit as far as collections from insurance or CMS? Is all that treated a little bit differently, or is it just the standard,
Oh, yeah, no, that's a good question. So for televisits, it's the same office visit code, except you have to use a modifier 95, as long as there's video. And if you're doing audio only, then there's another code for that too.
Yeah.
So,
Okay.
yep. And as far as reimbursements go, I mean, as far as I haven't heard anything awful. Right. The main thing I'd say is that the televisits, some are going to be paid as much. Some maybe will be paid a little bit less. The audio only ones, I think Medicare is probably paying about the same, but others, they may pay less. But it's rare that we do audio. That's a good question. So the question is what we do for televisits, and with the CARES Act and so on, they allow you to use really whatever technology that works best for you and the patient. So the biggest is going to be, we use Doxy.me, which has a BAA, and we also use Doximity as well too. And we have Helo televisits, but we found that Doximity or Doxy works the best, because with Helo, you kind of have to, if you have a 3:00 appointment, then the patient will only get the link at like 2:45 or so on. But if you want to, with Doxy, you can send them the link at noon if they're available. Now the Doxy network it went from nobody hearing of it to being literally hundreds and hundreds of millions of people using it all at once, right? So for the most part, Doxy.me seems to work well, but every once in a while, if we're talking to a patient and they get a call, then sometimes it hiccups. And then at that point in time, with the Doximity, which we use on our phones, we send them a link, but you have a button you can press to you can call them, and then you can talk them through on how to click the link and picture it. But the nice thing with the doxy.me is it'll show if they're using an iPhone, what device they're using. So anytime I get disconnected, I'll do a FaceTime visit with them, and then with my FaceTime for my caller ID, it just has my email. It doesn't have my cell number.
Okay.
So then I just get them, and I think with the FaceTime, if they're in a car traveling or so on, the FaceTime, with FaceTime overall, the connection has been fantastic. So that's probably the biggest issue is that number one, having your platform, but number two is not if, but when you have connection issues, what do you do? And we're always excited when it's an iPhone. If it's Android, then when you click on your iPhone, it'll show video. I could do Google Duo if I want. I've done WhatsApp. I've done whatever thing that the other person has. But
Right.
yeah, and then there will be sometimes some patients who will just say for their next one, they just FaceTime. So that's fine.
Right.
We'll just put that as one of their favorites. Yeah.
Okay. Awesome. And when Dr. Sam mentioned reimbursements and stuff like that, have you seen anything, Mickey, on reimbursement rates or any of that changing based on how they're coding it with being telemedicine? Are they going to scrutinize those differently than they scrutinize any other billings you submit?
Well, it's certainly evolving, but my prediction is that you're going to see reimbursement, being strong for telemedicine, because whereas before, even though this was beyond the embryonic stage, people were actually using telemedicine. COVID-19 has really forced the issue, and I think reimbursement has to come in line with that. And so, whereas in the past you might have seen lower reimbursement as it relates to telemedicine, I think going forward, I think this is going to be part of the new norm. I think you're going to see telemedicine being utilized quite a bit more, and it wouldn't surprise me if reimbursement, equates to a regular office visit. So,
right. I know as a patient, it seems like I'd almost pay a premium to do a telemedicine visit because I don't have to go anywhere. If you can do everything that you do in person, I'd rather do it remotely because I'm saving time. I'm not going anywhere. I know some things you have to be there for, but I find more value in telemedicine visit. Mickey, is there any place that practices who are struggling with cash flow, and I know it's more probably specialties, or just kind of planning, they should look out for useless spending, or is there any place they should be kind of watching out for things they're spending on they should be maybe not spending on, or trying to plan for that?
Sure, Sonny. Well, first of all, what I would really encourage every medical practice owner, whether they have an administrator or whether maybe they have a doctor that's a managing partner, is to project cash flow. We recommend a minimum of a 90-day cash flow plan. And I typically like to see 90 to 120-day cash flow plan. Mm-hmm. And when I start talking about that, some folks get intimidated about that plan, but really it's just a matter of projecting what you believe are going to be your regular cash flow from patient visits. Now, again, we've seen a lot of volatility in what that patient volume looks like. So, for example, I was having a conversation with one of the clients just last week where June of 2020 was as great, if not slightly better, from a cash flow and productivity perspective as June 2019. The problem with that, though, is we're not real sure if that's pent-up demand from being closed for almost 8 weeks, or if we're starting to get back to normal. But planning cash flow from about a 90 to 120 day plan will at least get you into a position to where you are not caught off guard, so to speak, as it relates to cash flow. And so, one of the things you do is you budget what you anticipate that revenue is going to be based on that schedule that you see of patients and that estimated reimbursement. Most clinics do have an overall average collection rate. So, for example, if you charge $100 for an office visit, and overall average reimbursement from all payers is maybe 70 cents on the dollar, then you can project, with some level of certainty what that revenue will be based on your bookings and, your appointment calendar. And then you just look at what those normal operating expenses are. Obviously, payroll is a big one, rent, utilities, et cetera. And you begin to project those over the next 90 to 120 days. And then what I would say as it relates to spending, expense management is a continuous process. It's not a one-time event. And really the best way to tackle expense management is to do what I call, stratify and know your numbers. So first of all, you look at your expenses, your highest expenses on a per monthly basis. Again, payroll may be that largest one, followed by some of your facility cost. But you stratify them in order of highest to lowest. And then you analyze that, from month to month and year to year, and just notice if there's any trend analysis there that would give you a level of concern. So if there's fluctuation, what's driving that fluctuation in those expenses? Okay. And then from there, do a real deep dive on any of those variations. And then you start to scrutinize, is this particular expense relevant to my practice, or is it just something that we've had and we've been incurring for years and years and years, and we just assume that it's necessary? Mm-hmm. And that could be as simple as looking at your advertising cost. I have some specialty groups where advertising is very important to what they do, and so their advertising spend can be significant. And what I challenge them to do is just make sure they're getting a really good return on that investment dollar of advertising. Now they have other clients where they're completely referral based, meaning that advertising, other than having a web presence and maybe having some level of web presence, social media may be the only advertising that they need to do. But it's really about scrutinizing the numbers, knowing the numbers, and then just eliminating anything that's not essential or critical to managing the ongoing operations, and then also the growth of the business.
Awesome.
Oh, yeah, I have one quick comment too. I mean, definitely, never let a crisis go to waste, right? So, I mean, we were trying televisits in the past, but the problem with it is it just wasn't reimbursed. So it was for the most part cash based, and that, so it wasn't working. But now with the televisits, that's something to really go forward with. And and the big thing is, if you look at a lot of doctors' websites, I mean, they've been kind of stagnant, the same website for a long time. Ours is WordPress. I mean, I can even update it on my phone for free. So, and even I've even talked to Google Business myself, and as far as Google AdWords go, I mean, basically they said they have tons of money. The thing they look for is good content. So might as well try to run with this as much as possible for televisits, because I mean, there's so many patients like Sonny, even myself for that matter. I mean, how often, I'm a doctor, how often do I get to go to the doctor? I mean, not really, but now that televisits are available, it's making it so much. And now I have an excuse to actually go to the doctor, and there's a lot of things that we can do through televisits. I mean, there's a lot of times patients would say, well, can we, I definitely am interested in my diabetes, and I try to get their lab work, patients' labs before they come in, but sometimes we get it at that point. But then, I can send messages through their Helo, but it's not the same. They say, well, I'd like a follow-up visit. Could you call? And I said, well, no, because I mean, we don't get paid in the past, right? But now we could do it through televisits, and it's great. And even we have patients who like are at Memphis visiting their parents or something like that, and we can order labs through our interface through Quest, and they can go to any Quest draw site in the nation, and when they go walk in to get their labs, automatically the labs go into our EMR too. So there's been a lot of silver linings that, I mean, knock on wood, hopefully we stay happy and healthy, but there's a lot of silver linings that this crisis has been opening up for our patients and healthcare.
Right. Hopefully it stays. Hopefully, yeah, this happened. We see it works, and telemedicine does work, and hopefully the insurers and the payers see that and they value that, where they'll keep paying it post crisis.
Yeah, and I'd say the big thing is when you go to any doctor's website. I mean, everyone's that's the number one thing that's our front door now. So
Yeah.
everyone just invests money on their office, but they don't really see the office, right? They see
Right.
the front door, and the front door needs to. I mean, all our patients have to have our patient portal. We try to get all of them to have Helo on their phone, and to make it clear for patients for televisits. And also now insurance, malpractice insurance companies are covering televisits for new patients too. So that's,
Good.
I mean, what we've done for new patients, generally it's like a spouse or a child or a friend, but for the most part, we're trying to get it where it's as easy as possible to log in and register online. But I mean, those I think it just our EMR companies have to just kind of catch up, with the pandemic.
That's right.
Yeah.
Awesome. Well, hey, I want to keep this on time. I know everybody's time is valuable. We had a lot of questions. We are going to post this webinar in the next 24 hours on our website so people can access it. So if you have a friend who was not able to make it, please share. Dr. Sam, I appreciate your time. I know it's your day off and you're helping us with this. So I really appreciate you joining. Mickey, thank you as well. Keith, thanks. This is great. I think it's hopefully some good information for everybody out there. If you need anything from a technology perspective, we're Acumen Technology. We do IT mainly for regulated industries like healthcare. And Mickey and his company, they obviously do the accounting, the audit, the consultancy for physician practices. And if you need healthcare, that's Dr. Sam. So anyway, I appreciate it. Thank you guys. And I hope everybody has a great rest of the day. Yeah,
you too. Thank you so much for sharing. That was very helpful, and I learned a lot from all of you.
Good.
Thank you, guys. Have a good one.
You.
See you guys.
Thanks. Okay. Bye-bye.